Welcome to Innovation Thursday with Houchins Insurance Group, where every week we're bringing you a new benefits-related topic. This week we're continuing our series on Self-Funding 101, and we're going to go over some pricing models within your health plan. The concept is plain and simply to pay less for your health care for your employees. You want to pay less for those claims. What options are available out there, and is it a good fit for my company or not? And that's kind of what we want to answer at a high level today. So pricing models. The traditional network, that is your Anthem, Humana, United, Cigna networks out there, or regional networks, depending on what area of the country you're in. That's what everybody's used to. Your pricing comes from a percentage off of the bill charges from that provider, and that's based on a contract. Your health plan would pay that amount for those procedures, and the employee would pay their portion right in line. That's what everybody's used to. Out there has been around for a while, and there's obviously some pros and cons to all of these. Fair market pricing, that is a not as well known pricing model, but that is basically data driven, basically pulling data from multiple sources and saying, hey, this procedure in this part of the country should cost X. That's what your pricing is based off of out there. The one that's been most publicized is reference-based pricing, or RBP. A lot of people call it Medicare Plus. Basically, that pricing is modeled as a percentage of Medicare. A lot of times they'll start out at 150% of Medicare is what the claims will be based upon. Go from there. Then one that is gaining traction and across the country, depending on where you're at, and works well in some situations, is something called direct contracting. It is where a hospital system or a provider chain will give you deeper discounts for steering your employees to go see that provider, and they'll give a little bit deeper discounts for that steerage versus your employees just going anywhere inside the network. So again, basically 4 different pricing models, very high level. And with that, we're going to change gears and talk about the pros and cons of each a little bit. Typically, and again, very in general speaking, networks work well. That's what everybody's used to. That is the easy button in our business, is knowing that you've got the Blue Cross, Humana, United Healthcare, Cigna, and a logo on your card. It's widely accepted, very little disruption, very little noise, as we like to say in our business for the mayor. However, that does come with a cost. You're typically paying a little bit higher cost out there because your employees can go wherever there is a network provider out there. So obviously, that's what some of your multi-location companies need. They're looking for that easy button and what makes the most sense for their employees. That's what the networks give you. The fair market pricing is it's a little bit better pricing, so a little bit lower pricing. However, it does come with some noise for your members because your providers may not recognize what it is, may not recognize how they're going to get paid. So it does come with some noise out there. As I mentioned, RBP, or reference-based pricing, is the one that's got the most publicity. Quite a bit of negative publicity out there on one side, but on the other side, when we're trying to control costs, that's one of the main tools that you could use. Again, it has to be the right fit. Again, we don't typically endorse one or the other. It really depends on what's the fit for your organization and your employees. But with RBP, what you're going to see is you are going to see lower pricing based upon that Medicare Plus model than your traditional networks. However, the noise or disruption level will be higher. There is a potential of balance billing for your employees out there when they have procedures done. Again, there's different vendors that you can plug in to help you navigate that piece, and there's lots of solutions available. So if we deem it as a good fit for you, then we want to make sure all the pieces and parts are put together inside the health plan for that. And as I mentioned, one that is gaining traction across the country, and we know several colleagues that have had some success with this, is direct contracting. You are definitely going to get a lower price. Again, that's that steer to say a regional or a hospital system is going to give you a better price on your claims if you send your employees there. So that cost of your claims is going down. And it's a little bit a mixed bag. It works better than, say, a reference-based pricing or maybe fair market from a noise level because it's specifically driving it to one facility that you have a contract with. However, it doesn't work if you're multi-location. So you say you're a trucking company, you got employees all across the country, that direct contracting may not be a good fit. Works well if you've got a local system and all your employees are under one roof or very centralized located. That may be a good option for you. So hopefully that kind of gives you a good overview. Again, different pricing models, they come with pros and cons. What my suggestion would be, get with a consultant and advisor such as us here at Houchins Insurance Group that can walk you through the pros and cons of each for your particular organization out there, and we can just decide what's the best fit for you and your employees. It really comes down to how innovative do you want to be? What is your appetite for more risk and more noise from your employees? Do you want them doing a little bit of work out there? Again, there's lots of different tools and resources that we use in those models. But again, it's all about, just like everything we've talked about, it's all about finding the best fit for your organization and your employees and what works for them. So hopefully this is beneficial. Everybody have a great week. We'll talk to you again next Thursday.